Welcome! Heartland Equine Health Center has created this presentation in order to introduce you to the Lameness Locator and how it can be utilized for performance horse evaluation. The Lameness Locator consists of three sensors, two accelerometers, one that attaches to the head and one that attaches to the top of the pelvis, a gyroscope that attaches to the right front pastern, and a handheld tablet loaded with analysis software that receives information transmitted by the sensors. The accelerometers measure vertical movements of the head and pelvis, and the gyroscope tells the software which foot is on the ground at any given moment. The gyroscope sensor is attached to the right front pastern with a special pastern wrap. One accelerometer sensor is placed at the center of the pole using a head bumper that securely velcros to the horse's halter or bridle. The second accelerometer sensor is attached to the top of the pelvis between the two tuber sacrali with double-sided velcro tape and secured with none other than special medical-grade white duct tape. Although the horse in this photo has had the area clipped, clipping of hair is not necessary. As the horse is trotted, either in a straight line or on a circle, the sensors transmit information about head and pelvic movement to the tablet computer via Bluetooth technology. The sensors can detect movement asymmetries as small as 3 millimeters, much smaller than the human eye can detect. This information is coordinated with the phase of the gait determined and transmitted by the sensor on the right front pastern, and the software then can identify which limb is lame and whether the lameness is associated with impact or landing pain, or with push-off or swing phase of the gait. The software provides its own overall analysis as well as the raw data collected. The numerical raw data is particularly useful as a baseline before nerve blocks or flexions, allowing us to precisely quantify how much improvement we have achieved after each block, or the level of deterioration after each flexion. Each trial generates a report that can be saved and/or printed for horse owners and trainers to keep in their own records. Trials can even be combined into a single report in order to compare, side by side, things like lunge left versus lunge right, or before versus after flexion or nerve blocks. These wave graphs illustrate in simple fashion how the software works. The flat horizontal line represents neutral head position when the horse is at rest. The bottom image is a symmetrical sine wave that would be created by the head or pelvic movement of a sound trotting horse, where the top peaks represent the highest point the head reaches as the horse pushes off to take a step, and the bottom troughs represent the lowest point the head reaches as the opposite limb strikes the ground. The top image, created by the movement of a lame horse, demonstrates both a higher peak or higher head position when one limb pushes off of the ground versus the opposite limb, and a lower trough or lower head position when one limb strikes the ground versus the opposite limb. The Lameness Locator is not novel, unproven technology. Over 20 years of research performed by Dr. Kevin Keegan and other researchers at the University of Missouri College of Veterinary Medicine has identified the most accurate measurements to collect in order to quantify gait abnormalities and correlate them with the sources of lameness. Once they figured out what information to collect, they had to figure out how to make the system portable and commercially viable for field practitioners and horse owners. Fortunately, the advent of tablet computers and compact wireless Bluetooth technology made things a lot simpler, and the first Lameness Locator systems were made available to practitioners in 2008. Data has since been collected and analyzed on thousands of horses all over the world. The software is continually being tweaked and updated in order to provide more and better information. In the future, Dr. Keegan hopes to develop software that can analyze other gaits, such as walk, canter, rack, foxtrot, etc., and also provide analysis of horses with neurologic problems. The Lameness Locator is not magic. It is not a replacement for a comprehensive lameness exam performed by a qualified, experienced performance horse veterinarian. What it is another tool in the toolbox for sport horse veterinarians that goes along with digital X-ray, ultrasound, and other diagnostic technology, helping the doctor to pinpoint and treat the sources of pain or poor performance. Once a diagnosis is made, the veterinarian can formulate the best possible treatment plan for the horse, including rest, intra-articular medications, intramuscular or intravenous injections, topical treatments such as Surpass, and many other treatment options. In addition to performance evaluations and lameness issues, including multiple limb lamenesses, this equipment is also useful on pre-purchase exams to help identify subclinical soundness issues in horses prior to purchase. Once a baseline is established, we can also use the equipment to monitor the patient's progress at set intervals or as needed as the horse returns to work after treatment or progresses in training. The Lameness Locator can be used on any breed or type of horse, but only works when the horse is trotting or pacing, the diagonal or laterally symmetrical gaits. It can be used to evaluate the horse in hand, on the lunge line, or under tack.